The CDC is set to release guidance tomorrow on how to get children back into classrooms safely, but questions remain about whether teachers should be vaccinated first. The head of the CDC says there's increasing data to show schools can safely reopen without teachers being inoculated, but many educators and staff say they want to get the shot before returning to school. For more, let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. So Dr. Hes, while data continues to suggest that very little transmission is happening within schools, is it safe to resume in-person learning if teachers are not yet vaccinated?
Yes, absolutely. If they wear masks, they are fine. If they wear masks and their students are wearing masks, the kids should be back in school. And we've been saying this over and over. And I just want to reiterate something. When they say like New York City schools are open for elementary, you have to remember that's only 5 days of school a month. So these kids are still not really getting a fair share of education. They're going 2, and 1 day. And only now in New York City in February, at the end of February, they're going to open the middle schools. And they have no plan to reopen high schools. So the teachers need to be back in school, just like the rest of the essential workers wear masks and go to work.
Yeah, and I should point out to everyone, because Dr. Hes, this is something that you've been saying for a while now, that when you say this, it's based on data. It's not just sort of a feeling that you're getting. You look at the numbers, and you're just not seeing the numbers to indicate that this is an area of concern. So I just want to get that out of the way. CBS News, though, is reporting that many of the nation's schools have already reopened without guidance from the White House. I don't know if that's concerning or not. We have talked before about how my daughter goes to a Catholic school. Her school reopened. They looked at the CDC guidelines. They looked at what the state was suggesting, and they kind of created something that they felt was safe enough. And it's been working. So should we be concerned that some schools have sort of just gone ahead and opened?
No, I think that's what they have to do because the guidelines are taking so long and they change from week to week. I think the schools have to put the children first and say, we're going to use our experts and we're going to talk to local leaders and local, our local mandates and see what we can do and get the kids back in school. Because if we wait for the CDC, these kids won't be back in school. And we've all seen it. They backpedal, they change their rules. But, other states have had kids in school the whole time. And I'm just saying, I was discussing with a speech pathologist yesterday how some of our patients are so far behind. And we really are seeing that the kids who are in the public schools that are not opening are not getting their services. They are not thriving. And the kids who are in private school have a huge advantage. So it's become a have and have-nots. And the kids who have are going to succeed more than the kids whose parents can't afford private school. And that's what it's become, unless you're in a state that the schools opened up.
Dr. Hes, real quick before we talk about the vaccine, I just have one more question on schools. We talk a lot about the data. Has there been any research done into, I know you just mentioned private schools, and Emery, you've talked about this throughout our coverage, but I also wonder about schools in less affluent communities where there are more children in the classroom, where the teachers, I don't know. I mean, in some schools, there are the appropriate number of students to teacher ratios, and in others, there are not. And so, the more people, the more, I guess, likely or the greater the risk that the virus can be transmitted. So, is that something that's taken into consideration? In other words, I know that we keep talking about schools reopening, and it feels very one size fits all. All schools should reopen because the data isn't there to suggest that that's where transmissions happen. But what about if you're in a school where there's, a lot more kids, a lot more people, security? I mean, I'm just trying to think a little bit outside the box here.
So you have to remember that school is not a normal school year this year. So they're not having gyms. So you have most schools have a huge gym that you could use as a resource for spacing out kids. They're not having all their specials because of art and things, just because they are so far behind that they're catching up on other things. They're not having music because, they don't want kids singing because it spreads coronavirus. So you have these other spaces. And remember, we're in a cold climate where I think you're in Philly, New York, but when you're in a warm climate, you can do outdoor classrooms, like a lot of people did in the summer when school started. And also, my kids have another vacation coming up next week. Do you really need a vacation when we've missed so much school already? So I think they have to start thinking about how we're going to catch these kids up, because even the kids who are doing remote and are doing well, they're not learning the same way that they should be. And I just think all the kids are at a disadvantage, but you have to be creative. Like, you see pictures from Denmark where the kids have like little pods, and even when they go out to the yard, they only stay with those 5 kids, so they minimize interaction with the other kids, and they're allowed to take off their masks and play in the yard. There's all different ways to do it. But I think we know, like in Long Island, the schools are open. They thinned out the classes. Some are hybrid, some are 2 days, 3 days, some are, 5 days, depending on the building size. It's ventilated. They keep the windows open. The kids might have to wear a coat, but they're going to school. And those kids are doing much better than our patients who are just sitting home. And I have to say, they are gaining weight exponentially. And this is all over the country because they are eating nonstop and getting no exercise.
Well, doctor, that is really interesting.
It is very interesting.
It's a little bit of kind of a running joke. The meme of the pandemic is about us, the adults, gaining weight. Everyone decided to bake sourdough bread at the beginning of this, and then they realized, oh my gosh, I gotta correct it. I didn't even think about the children. Of course, that totally makes sense. They're not going out to play, at recess if they're remote learning. They're not having gym class, even if they are in school. We should do a whole segment on that, but we have other things to talk to you about.
That's my passion.
Pfizer.
Pediatric obesity.
Oh, that's good to know.
Okay,
Yeah.
we're definitely getting into that then. Okay, so Pfizer, the first drug maker to roll out the COVID vaccine, is expected to cut in half the amount of time that it takes to produce a batch of the vaccine from 110 days to 60 days. We spoke to the Vice President and Chief Scientific Officer of Viral Vaccines at Pfizer about that. Here's what he said about how they're going to make that happen.
There are many steps to manufacturing. Indeed, the vaccine gets transferred between facilities in the course of being manufactured. And as you get better and better at the logistics of it, and as you just get experience, you can get faster and more proficient. It's something you do. When you do something over and over again, you find efficiency.
Okay, just as a little plug, you can stream that full interview a little bit later on this morning. We're going to have it. But Dr. Hes, what questions or concerns do you have about drug companies speeding up the process?
I'm actually not concerned because I think that they, just like he said, it's a trial and error, and they feel that they have perfected the science. They know the vaccine works, and now they are streamlining it. So I'm not really concerned. Also, remember, it's an mRNA vaccine, so it's different than a vaccine that's grown from other viral vectors. Sometimes that slows the process down, like if it's grown on adenovirus or other viruses, because you have to culture those viruses. This is a completely different new technology. So it is able to be streamlined, and they just use the DNA, get the RNA, and make this vaccine. And I mean, of course, I'm simplifying it, but the science is behind it and they know how to do it. And I'm not really worried. There's very, very strict quality control for vaccines. So I'm not really worried about that it's coming out soon. I'm actually super excited.
All right. Dr. Hes, always great talking to you. Thank you.